My mom died twice. The first time was when dementia slowly erased her memories and independence. And on April 1st, 2019, we lost her a second time, when we could no longer hug her and cuddle her and brush her hair. And this story is all too common. Perhaps some, if not many of you, are familiar. But I'm not here to be sad or make you sad. Quite the opposite. I'm here to share how the research has evolved around Alzheimer's and other dementias since my mom was first diagnosed. And my mom was a teacher. And I think she would be happy to know that I am learning and sharing what I'm learning as my retrospective case study. So let's start with her backstory before she lost her memories, because it's relevant. As an infant, she was covered head to toe in eczema because she was allergic to her cow's milk formula. Those allergies and many others traveled throughout her life. And we know now that allergies increase inflammation. They impact the immune system. Also, her childhood and adolescence were relatively stressful. Stressed out mom, shell-shocked dad. She helped to raise her two younger brothers. And we know now that those little t traumas and big T traumas impact our brain structure, literally changing the hippocampus, the memory center. But she had a lot of good years. She met my dad and went to college to become a teacher. She started her own family, had 4 kids. I'm number 3. But by the time I was 10 years old, she was very sick with a heart infection that had her on the heart transplant list. She fortunately got better enough to keep her own heart, but she didn't get well. Debilitating fatigue, cold and exercise intolerance, but symptoms that the doctors didn't quite understand. She didn't fit in a category. So they told her, "You're just depressed." Fortunately, about 5 years later, they did figure out a new diagnosis, an autoimmune disease that sort of fit her symptoms. And now she got this label, chronic fatigue syndrome, but they still didn't have much to offer her. So she sought out a support group with mostly other women, also with chronic fatigue syndrome. She went there seeking hope, but left full of fear, not just for herself, but for her children, because she learned from others that they had kids and relatives also with autoimmune disease, so she wondered about the genetic connection. I started with dementia. Why did I go so far back to childhood traumas and allergies and heart infections? Well, it's because it's really important for us to understand, we've now learned, that brain changes happen decades before dementia symptoms appear. If you're familiar with this kind of looking backwards to go forward, you might already be familiar with root cause medicine, sometimes also called functional medicine, precision medicine, systems-based medicine. But I'd like to contrast just for a second how it's different from our conventional or allopathic medicine. In that space, we usually wait for the house to catch fire and then try to contain the damage. It's about diagnosing and prescribing, where root cause or precision medicine is more like the fire inspector going through the house and trying to find the risks that might contribute to a problem down the road and addressing them. And every person is an N of 1 because everybody's different and might need different things. I talked about that support group that scared my mom, made her worried about her kids. Well, her fears eventually came true, and child number 3 was diagnosed with an autoimmune disease just a year after she was diagnosed with dementia. And multiple sclerosis attacks the brain and spinal cord. But I was working as an occupational therapist and was asked to present at the hospital to an MS support group. And the ladies were in there with their wheelchairs and their mobility aids, and I shared my diagnosis, and they welcomed me into the club I didn't really want to be part of. So just like my mom decades earlier, I left that support group with fear. But that is where our paths diverge. And it was a neighbor at the bus stop who introduced me to root cause medicine. And I went to the practitioner that had so greatly helped her kids with their brain health. And after a 4-hour session of digging into the root causes of MS, I left with hope and an action plan. This was quite different from my experience with the traditional neurologist, which was about diagnosing and prescribing and prognosis. So this is not a blame game. I'm not mad at my neurologist. They were just acting within the system that they were taught in. It's diagnose and prescribe. But they did tell me 3 things, quotes that I can remember still today, that stuck with me. My first neurologist leaned in and said, "Don't get fat." End of sentence, no further description. But now, studying brain health, I understand that increased adiposity increases inflammation. It's not good for the brain. He also told me, don't be the MS poster child. Okay, so again, now that I'm studying brain health, I think he was getting at mindset. And the way we think about things impacts the way we heal. So I left him, got a second and third opinion, and was really wanting to know my prognosis. It was the third neurologist who told me, you probably have about 20 good years without disability. So my husband and I wondered aloud, should we have a third child? And as we were escorted out of that appointment, the doctor sort of said offhandedly, you know what? Women tend to do better when they're pregnant. We should probably study that, but we can't get the funding. Pharmaceutical drugs are simple to study. Double-blind, placebo-controlled trials. Now, a multitude of interactive lifestyle factors are harder to study, but the pharmaceutical companies have a strong influence on our conventional medical model. But they're looking for the next patentable drug, not the next lifestyle intervention. But things are starting to change. And Dr. Dale Bredesen, the author of The End of Alzheimer's program, started his career as a neurologist, very conventionally, and he went into the lab to find the next miracle cure for Alzheimer's. And after decades of research, he realized that one pill is just not going to do it. There are too many interconnected factors that impact the brain health. So he applied for a study that would look at 36 factors and was denied. So he stepped out of the lab and into clinical practice with a profound but simple goal: to reduce the breakdown of synapses in the brain and support the growth of new ones. And guess what happened? Patient after patient reversed their cognitive decline. And 10 years later, this approach is catching on, and we have hope where there used to be none. And just in time, because the baby boomers are aging and we are at crisis point. 1 in 9 people aged 65 and over today have an Alzheimer's diagnosis. It's more common in women, so 1 in 5 women are expected to have a dementia diagnosis during their lifetime. But this data might actually be outdated, because a new study that came out in January of this year projects 1 in 2 people, 55 and over, to have cognitive difficulties by 2060 if we do nothing to change the trajectory. And this is no longer an illness of old age. We are seeing people in their 50s and 40s and 30s with Alzheimer's and dementia diagnoses in the prime of their life with young children. There are 3 things that we can't control that can impact our brain health. We can't control age or birth gender or genetics, but that's only a small part of our story. That's what we've learned, that actually there's a whole bunch of things that we can do to change our brain health story, and we have editing power. So now it's time to celebrate. Okay, so raise your hand and give a little shout if you have had a leafy green vegetable in the last week. Woo! If you have exercised in the last week. Woo-hoo! These are good for your brain. Do you have a friend or 2 or 3 that you can call on, that you can connect with? Good for your brain. But after the last 5 years of helping people optimize their brain health and reduce their dementia risk, I know that this is really hard to do alone. So, what now, neighbor? What if we create our own brain healthy community right here? And there is an example for us out there. In Frome, England, a doctor decided to solve for loneliness. And why did she attack that? Because loneliness increases mortality risk. Someone who is isolated has an increased risk of cardiovascular disease, stroke, and yes, dementia. And what she did in this community was just inspire connection. Their hospitalizations dropped, and the health of a whole community improved. So if you're wondering, what could I do? What could you do? Could you start a community garden at your place of worship? Or a walking club at your place of employment? Or a healthy happy hour with your neighbors? What we know is that connection inspires healthy behaviors to be contagious. And when motivation falls, there's somebody else to help pick you back up. I believe these connections that I've made have helped me on my path during my MS. To the point that last year, a new neurologist said, well, I'm not sure if you have it. Let's test again. So did the blood work, did the MRI, reconfirmed the original diagnosis, and the advice this time was different. Keep doing what you're doing. And what I've been doing is looking for root causes, treating myself as my own case study, the N of 1, and connecting with other health seekers. Nearly 40 years ago, my mom left her support group full of fear, but it didn't stop her. She was curious and always looking for root causes. This was before the birth of precision medicine. And I stand here before you today with tremendous gratitude for my mom and the healthcare providers who I have encountered in my health journey. I know now that I can write my own story. You can write your own brain health story. There are areas that we can't control, but they are a small portion of what contributes to our brain health. And the actions and the behaviors that we do together each day are much more impactful. So what if we stopped waiting for the next magic pill and came together as a community to make healthy brain behaviors as natural as breathing. Community gardens, walking clubs, healthy eating groups. What if our support groups, instead of being places of resignation, were laboratories of hope? My mom was a teacher, and her final lesson was this: classrooms, the greatest classrooms, are not just found within four walls, but among the connections we form with each other. Let this community be the next Froome. Let's write our brain health story, not just for each other, but for every mother and father and son and daughter who deserves a different ending. Thank you.